Where in the world is there notification where people are going, wow, that's great, you're HIV positive, hey, give me high five or whatever? Nobody. I don't know, maybe I haven't traveled very far. But I know one thing, I don't know anywhere in the world where people cheer each other up for being HIV positive. Hey, hi, I'm HIV positive, hey, bye, welcome to the club. And everybody's having fun and then going onto a taxi, going to the movies, having a prayer. Hi, how's your AIDS? Nobody does that.
In April 1999, the Minister of Health proposed to make AIDS notifiable. This means that in future healthcare workers like doctors and nurses will be required by law to disclose the diagnosis of an AIDS patient to different people. These people include immediate family members, caregivers, anyone who handles a dead body, local health authorities, and the Director General. The government claims that reporting to local authorities will be anonymous, but how can notifiability remain anonymous if families and caregivers will be informed? The government says that AIDS should be made notifiable to create openness, protect caregivers and undertakers, collect accurate data on the disease, and enable healthcare authorities to plan for the disease. But will notifiability achieve these goals? Other diseases, such as TB, are also notifiable, but experts say the data obtained is unreliable.
In some areas of the country, TB notification is abysmally low. It places the onus for providing the government and the planning authorities with the necessary information and data on the healthcare worker, the already overburdened and rushed healthcare workers.
But it's not going to be accurate data. It's not going to be data that we can really use in planning what's going on. The anonymous antenatal testing gives us a much better, I think, overall view of the spread of the epidemic and where we're heading with HIV and ultimately with AIDS.
The information obtained from notifications will give you an idea of the infectivity situation, anything from 5 to 10 years ago.
The only quick way we can get in monitoring if our intervention programs work is actually looking at the antenatal and the mother-to-child surveys, because then we can see, yes, the numbers are coming down, those programs are working.
Notifiability will be costly because extra staff and equipment will be required. Whether doctors and nurses would have the time to fill out forms and trace people is also questionable.
Doctors will see between 45 and 60 patients on average a day. So you have very little time with each person.
I will not be able to leave my present hours of duty to go out into the community to inform the family. That will have to be done after hours.
If Dr. Zuma still wants to go on with this, they must have more people who will be working in HIV/AIDS section alone, because it's going to be a hell of a job to be done by only one person or two people in the Khayelitsha area.
It's very difficult to trace people in the Khayelitsha community because the majority of people don't have telephones for a start. So it involves tramping around on foot basically.
How do I know the patient is giving me the correct address? This happened before, that we go to areas and we're sitting with the incorrect address and the client is completely lost.
Many feel that AIDS should be made notifiable to protect the public.
The healthcare sector is unable to give the support and the care for people affected by the illness. A lot of people get discharged home, they get looked after by their own families, and they die at home, and their bodies are prepared by close family members. We believe, at least, that sharing that knowledge of what is wrong with the person and being able to take the necessary precautions for other family members looking after the ill person would and first prevent the infection from being spread and allow the person to make the necessary preparations, and the family to be ready and to cope with the impact of the disease.
A young girl that had had a cesarean section at Grootske, the wound wouldn't heal. She was referred for us for further treatment, and she didn't know what was wrong with her. I don't know whether she was hiding it now. She didn't know what was wrong with her. She didn't tell the family what was going on. So the mother kept on coming with her to bring her for dressings and so on. Now the mother was asking us, why is the wound not healing? So we asked her, didn't Grootske tell you what is wrong? Why is the wound not healing and so on? No, the mother said she doesn't know, but she thinks whatever they did to her, this operation wasn't a success and so on. But then we couldn't say anything.
Experts warned that notifiability would give us a false sense of security. People would then only take precautions against HIV after they had been notified that someone had AIDS.
One can never be sure that with a country with such high HIV positivity rates that you are treating somebody who is not positive. You have to institute what we call universal precautions. And universal precautions means, amongst other things, treating every patient as if he or she is positive.
Is when there's infectious bodily fluids, you've got to use universal precautions. You've got to use gloves. So wherever it is, undertakers, whatever the person has died of, if there's blood around the place, or if there's abdominal fluid, or other infectious tissues, they've got to use gloves.